Welcome everyone to this edition of Speaker X. So Speaker X, the series that we have started to learn from our own community people, like those who are following the millionaire dentist journey. Okay. So those who are following the millionaire dentist journey implemented the same curriculum and have achieved some wonderful results. Okay. So in this Speaker X series, we have a wonderful dentist, a wonderful human being, a very simple, humble, very methodical, quiet, but a very good action taker. Guys, presenting Dr. Harshit Patel as our next speaker X and a wonderful success story from our community. So a very good morning to you, Dr. Harshit. Just unmute yourself and your first thoughts as you are here.
Yes, very good morning to all. First of all, thank you, sir, for giving me this opportunity to share my journey to all these like-minded people. And yes,
Okay, wonderful. So just introduce yourself as we start this speaker X.
yes. So myself, Dr. Harshit Patel, I am practicing in Gandhinagar, Gujarat since last 7 years. And by degree, I am MDS prosthodontist, but I do all the general dentistry also. So that is what.
Okay, wonderful. So, a prosthodontist practicing
Yes.
for 7 years in Gandhinagar in Gujarat. Wonderful. So, Harshit, how were your initial days of practice, and how did you evolve as a clinician after your post graduation?
Yes, I have started my practice in 2016. So when I started the practice, so my mindset or like that, I will जैसे पेशेंट आते हैं वैसे वर्क करेंगे, जैसे जैसे एक्सपीरियंस बढ़ेगा वैसे वैसे ग्रो करेंगे. सो माय माइंडसेट वाज लाइक दैट कि जैसे जैसे हम आगे बढ़ते हैं वैसे ही सीखेंगे और वैसे ही ग्रो करेंगे. So that was my mindset, and so there is nothing like a marketing management that all the teaching you have told to me, told to us. So that was the scenario before the joining the MDF.
Oh, wonderful. I liked what you shared actually, and I'll tell you why. Okay. Lot of people, when you start practicing, you are like, let's see how it works. Okay. So now look at this. Now, when we are not sure about what should be our next action step, okay, when we are not sure about what should I do next, or when you are completely directionless, you will end up achieving something. And now that something is like it may or may not be the thing that you want to achieve or that you wish to achieve. So always remember, this is not the right way, simply because you must have plans right from your day one. I tell you all this so many times, like, you must know where you see your practice a year from now, 2 years, 3 years, 5 years, 10 years from now. Okay. So if you don't know where do you want to go, it doesn't matter which road you take. And that's what happens with majority of us, not because we don't want to achieve something really big in a very short time, but only because we don't get the direction at the right time. So when we start practicing, you have all the mixed feelings. Okay, you have the feeling of fear, you have the feeling of anxiety, you have the fear, you have loans on your head, so you are worried about it. At the same time, you're excited to start your career. On one side, you're looking to do a lot of patients. On other side, you are like, whether I'll be do it properly or not, whether patients will come or not, isn't it? How many of you have seen this? Type me in the chat box if you could relate to this particular thing, isn't it? So all of us starts our journey, unfortunately, without direction. And honestly, that's not correct. But then when you start your practice, there is nobody to guide us. And that's one of the biggest void. That's one of the biggest lacuna that I always have observed. Okay. So You don't have the direction right from day one. Now, interestingly, that doesn't happen when you want to drive, when you drive a car. It doesn't happen when you travel either by bus, train, or flight. You already know where you want to go and then you start. But unfortunately, that doesn't apply to our own careers. So those of you who are new here, okay, those of you maybe like watching this on YouTube or any social media, and someone who is about to start the practice or who have just started the practice, one of the most important advice which I would give you is to set direction to your practice, set goals to your practice. Now, how to achieve the goals, whether you will be able to do it or not, it's a different ball game altogether. But at least first set goals. Set goals for a year, set goals for 3 years, 5 years, 10 years, short term, medium term, and long term goals. So wonderful mention, Harshit, because you mentioned this, I could actually talk about the importance of setting goals and having direction right from day one. Okay, so without that specific direction, how the things panned out within first few years of the practice?
So initial years, 2 years, I have just practiced and doing the consultation, and there is a no business mindset. I can say there is a हमारे फैमिली में पूरे जॉब माइंडसेट वाले हैं। तो उस टाइम पे अगर क्लिनिक में कुछ नहीं होता था, ग्रो नहीं हो रहा था, तो सारे वही बोलते थे कि जॉब ढूंढ ले। तो मेरा माइंडसेट भी वही हो गया था कि एमडीएस है तो फिर कोई कॉलेज ज्वाइन कर ले तो थोड़ा ग्रो होगा। तो मेरा माइंडसेट वही दिशा में जा रहा था कि अगर जॉब ढूंढ ले, या तो मॉर्निंग में क्लिनिक बंद करके कोई और जॉब कर ले, इवनिंग में क्लीनिंग कर ले। तो that was all going through, and I am not able to decide in which direction I should go. So that was the obstacle I was facing at initial 4 years of my practice.
Oh my God. Now, this is yet another powerful share. Okay, let me tell you. Now, when you start practicing, and in the initial months or years, if that doesn't work, you get all sort of thoughts. Did I make a mistake by becoming a dentist? Did I make a mistake by starting my own private practice? इससे तो जॉब ही अच्छा था। अगर पूरा दिन भर क्लिनिक में बैठकर पूरा महीने में अगर इतने ही पैसे कमाने हैं, I would have probably earned more as an MDS prosthodontist if I would have been associated with some dental college and all those things. By the way, how many of you get these kind of thoughts, or how many of you had these kind of thoughts in the initial weeks, months of your practice when your practice was not clicking beyond a point? Type me in the chat. Okay. And that's pretty, oh, some of you are saying like, I still get it. I do get it. Okay. I feel the same. Oh, wonderful. Now let me tell you something, guys. If you are someone who have this thought, please don't surrender to that thought. Okay. I'll tell you why. There's a very powerful saying: salary is a drug that kills your dreams. Okay. Salary is a drug that kills your dreams. It looks very good because salary immediately keeps you in the comfort zone. But the problem is you become so comfortable in the comfort zone that any kind of discomfort, you're not, you don't cope with it. You are not used to it. Eventually, you just don't want any discomfort in life. And that's why it's a drug. Okay, it's an addiction. So those of you who get this kind of thought, do not surrender to it, because I'll tell you what. It's always better to fight for your own dreams than fighting for someone else's. Okay, because when you're a salaried person, you're fighting for someone else's dreams, right? So don't do that no matter what. And as far as the private practice is concerned, all you need to know is to how to grow your practice. That's it. Okay, all you need to know is how to grow your practice, and it's only a matter of time. And if you're part of this community, the Millionaire Dentist Hub, you have already taken that first step. Okay, you have already taken that first step of knowing how to build that practice. And the rest, as I always say, just follow this system blindly. and follow this mentor blindly. Because here is someone who has already walked the path, seen all ups and downs, practice in a rural area, practice in a metro city, seen dentistry from every angle. And trust me, like those of you who are here since last 3 4 years in this community, I always say, you just don't need anything else apart from this entire curriculum and this millionaire dentist journey to take your practice to whichever level you want. Okay, so don't surrender to those thoughts. It's very easy to surrender to those temptations for early gratification. But guess what? The delayed gratification is something which is always bigger and better. As Robert Kiyosaki always says, you can leave the battlefield anytime. So why now? आप मैदान छोड़कर कभी भी भाग सकते हो, अब क्यों? आप प्राइवेट प्रैक्टिस छोड़ के कभी भी भाग सकते हो, why now? Give yourself one more try. Just keep on doing the right things. And every single time you think of quitting, just give yourself one more try. Ask yourself, why now? Okay. So, Harshit, how did you find the way?
In the lockdown, I have came across your webinar, and I have joined the silver level. So in the silver level, as a base of pyramid, that set my base of the practice. That is the mindset, because mindset and direction. For silver level course, I got there is something like a goal cards. There is something like differentiation points in the clinic, and the stranger secret. All those things I have followed blindly for the 2 months before I joining the gold and diamond. So after that, gradually I have joined the gold membership. The gold membership, whichever action I have, sir told, I have follow it blindly, whichever, though I have not implemented all the things at that time, but I have gradually, whatever I can do it, I have followed that, and gradually I have grow in the clinic.
Wonderful. So, so you joined during the COVID time. So you are around like or more than 3 years here now,
Yes.
and you have evolved a lot. So, what are the if I ask you, what are the top 2 or 3 things that became the game changer for you from this entire curriculum?
So first is no doubt mindset is the thing, because mindset ऐसी चीज है कि एक गाड़ी के इंजन की तरह होती है, अगर उसको ठीक नहीं किया गया तो उसका ऑल फीचर्स और लुक्स वो सब बकवास है, पर वो जो माइंडसेट है वो ठीक करना पड़ेगा. तो सो दैट इज द वन पॉइंट. सेकंड पॉइंट इज द अपग्रेडेशन. So because I have not my family is like self sufficient. मेरे को कोई भी पैसा घर पे घर खर्च के लिए नहीं देना पड़ता. So all I have making that surplus money I have upgraded in the soft skill or all the domain skill and in the equipment and material since last 2 years. So that is upgradation given me the point of differentiation in the clinic, in the comparative to the other clinic, and the work has become very smooth because of that upgradation. And the third thing is the live session. So I am frankly speaking not attended all the live session, but I never miss the recording. So silver level, that ICM is like mindset. That is the bulletproof mindset. If you stop attending ICM, your mindset will not remain bulletproof. And the second thing is Dentathon. So Dentathon is all about actions. So I have joined Dentathon, follow 2 3 cycles, and that 1 or 2 cycles I have missed. So what I feel at that period, I have my action becomes slow, because दो तीन साइकिल आप अटेंड करते हो तो आपको पता चल जाता है कि यही होने वाला है, यही होने, और कुछ नया आने वाला नहीं है। पर जैसे सर बोलते हैं कि हर एक सेशन में एक ना एक चीज तो होगी कि जो आपको नई सीखनी मिलेगी, और जो मुझे मिलती है। तो नेवर मिस दैट डेंटाथॉन साइकिल ऑल्सो इफ यू हैव अटेंडेड previous cycle also. And C3 call is like that tricky situation. So C3 कॉल में मैं क्या करता था कि जैसे ही कोई पार्टिसिपेंट क्वेश्चन पूछता था तो मैं वो क्वेश्चन लिखता था, सर के आंसर देते थे वही लिखता था, और उसको मैं गुजराती में ट्रांसलेट करता था क्योंकि मुझे पेशेंट को गुजराती में आंसर देना। तो वो पिच पॉज एम्फेसिस के साथ वो मैं रिहर्सल करता था ताकि जब भी ऐसा सिचुएशन आ जाए वो तुरंत मेरे माइंड में से बाहर आ जाए। तो ये सब ये तीन चीजें मैं फॉलो करता था और इन्हीं ने मुझे ज्यादा रिजल्ट दिया है। वैसे तो बहुत सारी चीजें हैं पर ये तीन इफेक्टिव है मेरे लिए।
Oh, and this is pretty powerful, isn't it? How many of you really think that was powerful? Now, imagine the kind of hard work that you need to put. If you really are serious, that's what I was saying in the beginning. If you are really serious about growing your practice, now imagine somebody, taking all those dialogues from my sessions, the answers that I give, translating it to the local language, because at the end of it, you have to deal with your patients in your language, okay? And rehearsing it. This is the kind of hard work that it actually takes. And guys, all of you, just take this inspiration. If you do this kind of hard work, trust me, even you yourself cannot stop yourself from growing your practice to whichever level you want. Okay. So this is amazing. So the top three things that, Harshi shared, and as I said, there are so many things, right? The top three things, number one is working on your mindset, no matter what. I always say your practice is just the reflection of who you are. Okay. So work on yourself, your practice will grow automatically, right? Number two is the upgradation. I can't like emphasize more than this, that all the time it's all about upgradation all the time. Keep on upgrading yourself in soft skills, in management skills, in clinical skills. Okay. And the third is attending the live sessions. If you are a silver member, inner circle master classes are the live sessions. If you are gold member, the dentathon sessions are the live sessions. If you are diamond member, the core council calls are the live sessions. So the best thing is to be everywhere, simply because you get different content with different context at every live session. And if you are willing to put this kind of hard work, you are bound to create miracles in your practice. So Harshit, what was the miracle? What kind of results you have seen over a period of last 2, 3 years in your practice after being
Yes,
part
I
of this?
yes, revenue wise, it is almost a double. It doubled my practice, but I can say the more than a revenue. I can say that I am enjoying my practice. Whichever treatment I am doing, I thought कि कैसे मैं उसको 1% बेटर बनाऊं और कैसे पेशेंट को और ज्यादा अच्छा ट्रीटमेंट दूं। So, whichever domain skill I learn, so I am always excited to implement that new learnings. Always that is improving my soft skill and domain skill. So that is the important part. At the end of, you should enjoy your work.
Superb. So imagine practice doubling, okay, within just 2, 3 years. So how many of you think that is wow? Just type wow in the chat box, because with so much of competition, noise, etc., around, okay. Now you might be thinking, oh, sir, double. So there are so many people in our community. But then imagine wherever your practice is today, if you can double it every 3 years also, think about it where you will go. Okay. And it's a live session, Vikas, so we can't talk about numbers. Okay. So it's and numbers are not required. So even if like your practice is 1 lakh and it becomes 2 lakh, your practice is 50,000 becomes 1 lakh. If your practice is 5 lakh, it becomes 10 lakh, doesn't matter at all. Okay. It's all about the percentage growth rather than the numbers, because numbers keep on changing. The percentage should and remains and will remain same. So as I'm telling you, like those of you who are working on growing your practice, no matter where your practice is today, just keep this target that I'll double my practice every 2-3 years, and imagine where will you reach within next 10, 15, 20 years. Okay, so that's pretty powerful. Superb. So congratulations, Harshit, for that. And one very important thing that you shared was, I have started enjoying my practice. So I always say this: doing practice is one thing, enjoying practice is completely another. Okay, so doing practice is one thing. There are, every single practitioner is doing practice because अब डॉक्टर बन गए तो दूसरा क्या करेंगे. Okay, but not everybody enjoys the practice, and that's why when you work for like 5, 10, 15 years, the routine sets in, the monotony sets in, and eventually you get bored of your own practice. Okay, so even if you're started, you make money, that money excites you in the first years of your practice, because you have to clear the loans, EMIs, you have to buy the house, you have to buy the car, you have to do few vacations, and that maybe few overseas trips. Once that is done, the question you start asking to yourself is, what next? And then you start getting those Monday morning blues. Then you start getting those midlife crises and whatnot. How many of you have seen such people around? Type me in the chat. Okay. But when you are enjoying what you are doing, trust me, it doesn't remain work for you. Okay. So very, very important. So start enjoying what you are doing. And one of the best way to do it is having that, that right mindset of doing as better for your patients as you can, as much for your patients as you can, giving the best of treatment, giving the best of consultation, giving the best of experience. And if your patients are happy, you are happy. Okay. So wonderful. So what would be your parting message to everyone here, Harshit?
So parting message, follow the system sir has created blindly, follow your mentor blindly, and whichever always that keep your parachute open. So one thing I have to share that I observed this sir, the pitch was emphasis every session. So I have gone through recording that sentence repeatedly, and what sir has used. So if you keep your parachute open, you have so much opportunity to learn, and always have a learning mindset. So if you have learning mindset, you will grow definitely.
Superb. And that's powerful. Okay. So keep your parachute open all the time. Keep on learning all the time. And most importantly, observe every minute things that happens. Okay. And you will become unstoppable. So congratulations, Harshit.
Thank you, sir.
Yeah. Enjoy your success. And most importantly, keep growing to the next level. Okay. So as I always say, abhi to party shuru hui hai aur picture abhi baki hai, right? So wonderful. Congratulations to you. And guys, with this, let's conclude this particular session of Speaker X. Okay. Just put your comments in the comments, or maybe if you're watching it on YouTube. So how did you find this? And if you learned something, and what did you learn from